I'm Jill Russell and I'm the Qualitative Research Methods Lead for the Research Design Service, London. I'm a Senior Lecturer in Health Policy at the Centre for Primary Care and Public Health at Queen Mary, University of London. I've worked as a qualitative researcher for over 30 years and I've also taught on a number of introductory and advanced qualitative methods courses. Qualitative research addresses questions that generally begin with how or why. Rather than a focus on measurement, there's a concern to explore meaning and an emphasis on interpretation. For example, why do some patients not take the medicines they're prescribed by their doctor? Or how do online support groups help patients with cancer? The use of qualitative methods alongside trials of complex interventions is increasingly recognised as adding value to research studies. For example, qualitative methods can help unpack the processes of implementation of a trial and can help with interpretation of quantitative findings. At RDS London, we find that many study teams want to include a qualitative component to their study, but have little experience of how to undertake this type of research. So how can our qualitative advisors help an applicant? First, by helping them think through appropriate qualitative methods. For example, whether to use interviews, focus groups, or perhaps ethnographic observation. Second, by helping to identify appropriate approaches to analysing qualitative data. Most applications we see tend to choose a qualitative approach known as thematic analysis, but it may well be that a richer analysis can be gained by drawing on other approaches, such as narrative analysis. Thirdly, we can help researchers work out the appropriate scale of the research and resources that will be required to undertake qualitative work. How many interviews to undertake, what resources are needed for transcribing interview data, how many sites to select for case study work, and so on. One common area we find ourselves giving advice on is the need to be clear about the distinction between qualitative research and patient and public involvement. These two aspects of a proposal often get confused and conflated. Patient and public involvement is about getting patients' input to the study design, implementation and dissemination, whereas exploring patients' views to address specific research questions and systematically collect data on these views constitutes research. This is sometimes a subtle but nevertheless very important distinction. Another common piece of advice our qualitative advisors can give concerns making best use of existing research findings. Applicants sometimes forget to explore what other researchers have already found out in their field of interest. We can help steer applicants towards relevant social science databases so they can review the qualitative evidence base in their particular area and ensure their proposed study builds on existing work.